Good afternoon, everyone. Myself, Dr.Sandesh, Biradar. I'm a yoga and naturopathy consultant, ChanRe RICR Center. And I'm going to talk about role of yoga therapy in arthritis management. So let's see what are the benefits of doing regular yoga in arthritis patients. So yoga is one of those holistic treatments which can significantly improve and reduce the psychosomatic symptoms and the pain perception. Pain perception in the sense like the same amount of uh, damage or injury might give different intensity of pain in different people. So that is because of the perception of pain. So regular yoga can significantly improve the perception of pain and the disability quotient. It can improve the range of motion and the flexibility of joint, the posture, muscle strength, and coordination of the joints and muscles, and the overall disease activity. So what yoga does basically is, so it's a mind-body technique, and there is a neuroendocrine pathway in the body. So this neuroendocrine pathway is very susceptible to any uh, imbalance when there is a stress. So yoga, it reduces stress and it maintains the homeostasis of the neuroendocrine pathway, and thereby it relaxes the body and by maintaining the flexibility and improving joint mobility. So many of these complex diseases like cardiovascular disease, depression, autoimmune disease, they are all arising due to genes and the environmental factors and some of the unhealthy social habits like smoking, alcohol consumption. And these risk factors, they affect our hypothalamic pituitary adrenal axis. So whenever there is a stress or there is a bad lifestyle that you're following, your hypothalamus is constantly under pressure. So it releases too much of a hormone called cortisol, which is a stress hormone. So this hormone has been shown to be very noxious. It uh, it makes wave to a lot of diseases, and autoimmune and arthritis is one of those. And oxidative stress, depression, anxiety, short telomeres, chronic inflammation, gut microdysplasia, and dysregulated immune system. So yoga targets each of these risk factors and corrects these dysregulated systems, and thereby bringing about homeostasis. In this chart, if you can see, this shows how our stress is affecting our health. So if you see psychological stress, it gives rise to oxidative stress, and thereby oxidative stress also leads to psychosis. So this is a cycle. So first there is immune system hyperactivity, increases sympathetic tone, and precipitation of autoimmune symptoms, abnormal neurodependencies, and thereby release of inflammatory cytokines. These in turn have a lot of effects on our immune system. So if you can see, there's a dysfunction of telomerase activity, increased telomerase activation, and altered cell cycle regulation, and activation of DNA damage responses, which in turn leads to production of reactive oxygen species. So stress has been shown to have a lot of negative effects on our immune system. So yoga, by reducing your psychological stress, can reverse or at least prevent it from aggregating. So what are the procedure of yoga practice? How to do and what to do? So it basically includes three main components, that is asanas, pranayama and dhyana. Asanas, it's maintenance of a physical posture. So after attaining the full posture, we should at least maintain it for 30 seconds or more if it's possible. And the pranayama followed by pranayama, which is synchronous deep breathing exercises. It includes deep breathing and alternate nostril breathing and cleansing techniques, which I'll be explaining further. And dhyana, that is meditation. So there was a study done on yoga-based lifestyle intervention and how it affects rheumatoid arthritis. So the subjects in that experiment followed the following steps. First, they started their practice with Sukshma Vyayama, which includes finger loosening, wrist loosening, elbow loosening, and toe bending, ankle bending, kneecap tightening, patella movement, hip rotation, knee bending. So this can be done for 5 minutes. So initially, when you wake up in the morning, usually you can find the joints are stiff. It's not easy to move your joints as soon as you wake up. So in that context, first start your practice with Sukshma Vyayama and then begin to step number 2, which is the yoga asana. So in asanas, the subjects followed the following set of asanas. In standing position, they first did Trikonasana, Kati Chakrasana, Tadasana, and Virabhadrasana, each for 5 minutes. Each asana can be held for 30 seconds to 1 minute and then be released in a slow and proper manner. So all these asanas will take maximum of 5 minutes. So in Trikonasana, from the standing posture, you will first keep your legs apart and raise your hands to your shoulder level and try to touch your foot with the same hand. So in example, you will stand straight, lift your shoulders to your shoulder level, lift your hands to your shoulder level, and touch your feet with your right hand. So similarly on the opposite side. And in Kati Chakrasana, it's a twisting of your spine towards your opposite side. So you have to hold your hand to your shoulder, touch your, say example, touch your right hand to your left shoulder and twist your spine to your left side and hold it for 30 seconds. Tadasana is just standing straight and relaxing your whole body, keeping your spine straight, observing your posture, and holding it for 30 seconds. Next is Virabhadrasana. In this posture, you stand straight, keep your legs apart, and hold one of your knees and hold it for 30 seconds. Your hand can be either in Namaskar position upwards or it can just be straight on your shoulder and hold it for 30 seconds. So sitting postures, we first started with Gomukhasana. It's also called cow pose, followed by Paschimottanasana, Shashankasana, it is also called rabbit pose, and Vakrasana. So each for 30 seconds to 1 minute. So this set of asanas is also take 5 minutes. And then in prone position, they started with Ekapada Shalabhasana, Bhujangasana, which is also called Cobra pose, Purna Shalabhasana, and Makarasana is also called crocodile pose. Each hold for 30 seconds to 1 minute, and all these sets of asanas will take 5 minutes. In supine posture, they practiced Uttana Padasana, Setu Bandhasana, Pawan Muktasana, and Matsyasana. So after the first step was Sukshma Vyama, next was Yoga Asanas, and then we go to Shavasana. So this is a very important practice and a must and should after you practice other asanas. So in this asana, you'll lie down on a mat, your body completely relaxed, putting all your weight on the ground, and you will start the something called deep relaxation technique. So in this technique, you have to relax your part. You have to relax your body part by part. So first, we'll start with your toes, relaxing your toes, then relaxing your calf muscles, your thighs, your waist region, relaxing the abdomen region, chest region, shoulders, neck, face, and then head. So this part by part of relaxation. The next step is doing deep breathing. So you have to inhale deeply in your abdomen and then exhale slowly and completely. This can be done for another 10 rounds. And then after that, just relaxing, keeping your body still, observing the changes in your body after all these practices. And then you can get up and proceed to step number 4, which is the pranayama practices. So in this, the first one would be Kapalbhati. In Kapalbhati practice, you will be sitting straight. You can sit in Vajrasana, Padmasana, if it is possible, or else you can sit in a very simple, comfortable posture called Sukhasana. So in Kapalbhati, first what you'll do is you'll take a deep breath in, and for the next 60 seconds, that is 1 minute, you'll only be exhaling. Just take a deep breath in. So for the next 60 seconds, you'll be only exhaling the air outside. So somebody who is starting the practice, who is not a regular practitioner of this pranayama, who is a beginner, can do 60 strokes in a minute. That is one stroke in a minute. And as and when you are regularly practicing and you're acquainted with this, you can go up to 120 strokes, 180 strokes per minute. People with hypertension and should do it cautiously under guidance of an expert. And someone with hernia should completely avoid this posture, or you can take advice from an expert and then you can. And Ujjayi pranayama. So in this pranayama, you can again adopt Vajrasana, Padmasana, or just a simple sitting posture. So first, you'll take a deep breath in, and with exhaling, you have to contract your glottis. So, in simple terms, while exhaling, you will make the sound of a snoring sound. When somebody is asleep and when you hear the snoring sound, yeah. So something like that. You have to contract your glottis while exhaling. So it goes like this. And while exhaling, so this pranayama, this completes one round of this pranayama. So this can be done up to 9 rounds. And next one is Nadi Shodhana pranayama. So in this pranayama is also called alternate nostril breathing. So as the name suggests, this involves breathing through one nostril and exhaling through another nostril, and then breathing through another nostril and exhaling through another nostril. So you have to adopt first Nasika Mudra, that is, hold your index and middle finger, and with your thumb finger, you can close your right nostril, and with the other last 2 fingers, you can close your left nostril. Inhale through your right nostril and exhale through your left. Hold the breath for 5 seconds. Then inhale through left, hold the breath, exhale through left, right, and hold the breath. So this completes one round of Nadi Shodhana pranayama, and this can be done up to 9 rounds and 2 times in a day. The next is Brahmari pranayama. So in this pranayama, you can There are various techniques of doing this pranayama. So one simple technique is you can use an index finger to close your ears, both the ears, and after deep inhalation, you have to make the sound of a humming bee. So for beginners who have not done this pranayama earlier, it can be difficult to do a prolonged phase of pranayama. It can be only up to 8 or 10 seconds, 5, 6 seconds. But as and when you practice, you can go up to 15, 20 seconds. The prolonged it is, the better. That is the moral of the story. So all these pranayama will take approximately 15 to 20 minutes. And the next is dhyana. So there are so many schools of meditation, there's so many techniques of meditation. And it's a very important aspect of yoga therapy. Like this is the all the asanas, pranayamas we do. It's all there to prepare your body for this phase. So I would suggest one simple technique which all of us can follow is something called vipassana, and these days it is given the name mindfulness meditation. So it's a very effective, it's simple and very effective technique of meditation. So in this meditation, you will again adopt a simple posture. It can be sukhasana, vajrasana, or padmasana, but make sure that your spine is straight and your neck is straight. And so you will start by observing your breath. Initially, you can start observing your breath. So after each inhalation and exhalation, there is a gap. After you inhale and you exhale, there's a small gap between your two breaths. So you have to start observing this breath, this empty breath. So as and when you start observing this gap, so initially the gap will be very less. As and when you start observing this, the gap between two breaths, it goes on increasing, which is a good sign. It means that you've done this meditation in an effective manner, and your mind has calmed down and your breath has become slow. So this is one indication that you're doing this meditation in the right technique. The other thing is later on, once you start observing your breath, so after a few days, you can start observing your thoughts. So when you're just sitting, simply sitting, doing nothing, if you observe, there are a lot of thoughts going on. Even when you don't want it, it's on autopilot mode. No, it's just going on. It's not under your control. So that time you can just sit and you can start observing your thoughts. And initially, when you start doing this, you can notice that your thoughts are simply running. There's no gap, there's no break to it. And it has no command, follows its own command. So when you start observing your thoughts, the gap between your thoughts, it's going to be difficult, but if you practice and if you are able to observe the gap between thoughts, you notice that the thoughts are becoming lesser and lesser, and the gap between thoughts is becoming more and more. So this is also very effective technique in someone who is hoping to achieve control of mind and peace of mind. All these techniques are definitely going to help our immune system and our joints, muscles, the functioning of our joints, muscles, the strength, balance, the posture. So the key point is that has to be done regularly and do it on a yoga mat and do it in empty stomach, preferably early in the morning. And if any time later in the day someone wants to practice, there should be at least a 3 hours gap between your last. So this was all about it. I hope you all find it useful, and I suggest you all to practice this asana and pranayama and meditation on a regular basis and keep your arthritis in check.